Hi, I'm Dr. Yousuf Mahomed. So, if you're taking prescribed opioids for chronic pain, you might be feeling a little bit lost, maybe even worried about what comes next. Look, it's a really tough spot to be in, and I just want to start by saying whatever you're feeling is completely valid. And that's exactly what we're going to talk about today. My goal here is to answer that big question head on, giving you a really clear, science-based path forward, with zero judgment. This is all about empowering you in conversations about your own health. Okay, so let's dive right in. First, we need to understand what's actually happening inside your body on a biological level. And just to be clear, this is pure science. It's not a moral issue, it's just how our bodies work. Understanding this is always the best first step. The first thing you'll probably encounter with long-term use is something called tolerance. And you know what? It's a completely normal and predictable response. It just means that over time, your body adapts, and the same dose you started with doesn't give you the same pain relief anymore. Here's a really simple way to think about it. Your nerve cells have these things called receptors, which are like little locks. The opioid medication is the key. When the key goes in the lock, you get pain relief. Simple enough, right? But your body is smart. Over time, it starts building more locks. So now, the same number of keys you've been using can't open all the new doors. The effect gets weaker. This isn't you failing, it's just your body being incredibly adaptive. Now, this is where things get really interesting, because the way we talk about this stuff matters. There is a massive and frankly harmful misunderstanding that we need to clear up right now. This is probably the most important thing you'll take away from our chat today. I mean, just look at this quote from the New England Journal of Medicine. It says it perfectly. People mix up dependence and addiction all the time, and it creates so much unnecessary fear for patients who are just trying to follow their doctor's advice. And this chart lays it out beautifully. On the left, you've got physical dependence. That's just your body adapting. If you were to stop cold turkey, yeah, you'd have withdrawal symptoms. It's a physical thing. But on the right, you have opioid use disorder, what we call addiction. That's a totally separate brain disease, defined by behaviors, like losing control or using despite serious harm. One is what your body does. The other is a complex medical condition. They're not the same thing. In fact, for a doctor to even diagnose OUD, a person has to check off at least 2 boxes from a list of 11 very specific criteria. And as you can see here, they're all about behaviors that cause real, tangible problems in a person's life. It goes way beyond just the physical stuff. And here it is. This is the crucial points. The official diagnostic rulebook is crystal clear on this. If you develop tolerance or experience withdrawal while taking your medication exactly as your doctor prescribed, those things do not count towards a diagnosis of opioid use disorder. Let me say that again because it's so important. Your body's physical adaptation to a prescribed medication is not addiction. So, what happens if you and your doctor decide it's time to lower the dose? How do you do that safely, in a way that's humane and actually works? It's not about being cut off. It's about creating a roadmap together. Let's take a look at what that journey looks like. This is the number to remember, 10%. A really good, well-tolerated approach is to slowly reduce your total daily dose by about 10% per month. That's it, nice and slow. It gives your body plenty of time to catch up. The whole point here is to avoid shocking your system. This isn't about stopping cold turkey, which is honestly just a miserable experience. This is a gradual, managed process designed to make it as comfortable as possible. Think of this whole thing as a partnership. It's not something that's done to you, it's something you do with your doctor. You make the plan together, you go slow and steady, you have regular check-ins, and you know what? Pausing is okay. If you're having a tough week, you can hit the pause button. The goal is always, always to improve your quality of life. And that's the thing, success looks different for everyone. The CDC guidelines says it all. For some people, success might be getting off the medication completely. Awesome. But for someone else, it might just be finding that lowest possible dose where you feel great and the benefits totally outweigh any risks. It's your goal. Now for the really great news. You do not have to do this with willpower alone. Not at all. There are some really powerful medical tools out there that can act as a support system and make this whole journey way smoother. We call these adjuvant medications, which is just a fancy way of saying they're helper medications. For example, low-dose ketamine can actually help reset your body's sensitivity so that a lower dose of your opioid feels more effective. Then you have things like clonidine, which is amazing for calming down those physical jitters and anxiety from withdrawal. And drugs like gabapentin can really help with any nerve pain that might pop up. So these aren't replacements, they're supporters. They each work on a different piece of the puzzle in your nervous system. They're there to ease the discomfort and just give your body the backup it needs while it finds its new normal. Just understanding the science, just seeing that there is a roadmap, that's a huge, powerful first step. You've just armed yourself with knowledge, and that is the key at taking back control. Because at the end of the day, that's what this is all about. It's about empowering you. It's about shifting the focus from just a number on a pain scale to your overall function and your quality of life. It's about giving you the tools to have real, informed conversations with your doctor. So, my final question for you is a simple one. Are you ready to take this knowledge and use it to build a pain management plan that's actually personalized for you? One that's safe and, most of all, compassionate? If the answer is yes, then the next step is to talk. I'd like to invite you to book a one-on-one advisory session with me. We can go over your specific situation and start building that personal roadmap together. Thanks so much for your time.